Meanwhile, a day after a futile meeting between the Labour Ministry and striking healthcare workers' unions, various medical associations have met with the Council of Governors Chair Wycliffe Oparanya to discuss ways to end industrial action by the health workers. And while Governor Oparanya maintains that the issue should be resolved at a county level, a new battlefront between health workers' unions and the government has now opened up. Raquel Muigai with more details.
It has been 51 days since the nurses began their strike, demanding better pay and treatment by their employers. But even before that has been resolved, a recent letter by Health Cabinet Secretary Mutahi Kagwe has sparked another row. The letter dated 22nd December 2020, written by CS Mutahi Kagwe, addressing Public Service and Gender CS Professor Margaret Kobia, and copied to the COG and Principal Secretary at the Ministry of Health. Mutahi Kagwe states that arising from the consultative meeting held between the Ministry of Health and Council of Governors on the 21st of December 2020, it was decided that with effect from the date of this letter, the Ministry and the county governments will not play the agency role of remitting union dues to the unions in the health sector, a decision that has not been taken lightly by the Kenya National Union of Nurses, who responded in a letter dated 26th January 2021, requesting CS Kagwe to revoke the letter as a show of good faith in the ongoing negotiations as it contravenes labour laws. Failure to which the union indicates it will institute contempt proceedings against the CS and any other person acting on the strength of the letter. This coming at a time when medical associations of the striking health workers opted to intervene by holding a meeting with the Council of Governors Chairman Wycliffe Oparanya.
We want these issues to be handled based on facts and not people's personal opinions. We are still going to talk to our counterparts from the leadership of the trade unions so that they can also come to the table for the sake of the Kenyans and address the issues that they have raised with the relevant authorities on the table.
If they don't come on the table so that they can tell us what the problem is, they would then have their so-called political leaders to employ them.
According to Governor Oparanya, issues raised by the health workers should be resolved at county level. He says he has already addressed the issues.
As a government, we have been proactive. We have also employed, yesterday we employed 61 nurses and nurses and clinical officers. And in another 2 weeks, we are going to employ another 90 if the strike will have not been called off.
So far, negotiations between the trade unions of the striking health workers and the government have proved futile. The Kenya Medical Association, the National Nurses Association of Kenya, and the Kenya Clinical Officers Association requesting involved parties to remain committed to finding a solution. Raquel Muigai, Citizen TV.